Aparna Rao. I am an Ayurvedic psychotherapist, a passionate infopreneur, and medical writer. I am on my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally. In this discourse, every week I organize discussions on Ayurveda, psychotherapy, and mental health with the professionals from the field. This week, too, we have a discussion, and this is a continuation on this afternoon. The discussion is a continuation on my Ayurveda awareness series, where we are talking on authentic Ayurveda and evidence based Ayurveda. Here, when I talk about Ayurveda and authentic Ayurveda, it would be rather incomplete to not speak about the essence of Ayurveda, also the objective of Ayurveda. So, Ayurveda says, Swastasya swastya rakshanam, aturasya vyadhi parimokshanam. So, what Ayurveda means is to prevent and preserve the health of healthy, to protect and preserve the health of healthy individuals, and to treat the disease from its and to wipe it out from its root cause. That is, we call it samprapti in Ayurveda. So that is pathogenesis, to wipe out the disease from its pathogenesis. So, Ayurveda does not only add years to the life, but also adds life to the years. That means Ayurveda believes in both qualitative and quantitative approach. So, here in the fascinating part about Ayurveda is Ayurveda is it has its unique and customizable approach for every individual according to the prakriti and for every disease for every individual. So one size fits all is never applicable to Ayurveda. That means, in short, one paracetamol can treat all kinds of fevers is absolutely no when it comes to Ayurveda. So, on this note, we are. I am very happy and delighted to introduce my guest, who believes in evidence-based Ayurveda and precision Ayurveda. So, my guest today is a mechanical engineer, an IIM postgraduate turned healthcare entrepreneur, and that is an Ayurveda entrepreneur, to be very precise, an AyurVaid entrepreneur. He's himself a veteran in Ayurveda Chikitsa. He is none other than Shri Rajiv Vasudevan, sir. He is the founder and the CEO of AyurVaid Hospitals. Namaskaram, sir.
Namaste, Dr.
Welcome to the discussion, sir. And
Namaste,
thank
Dr.
you for making time for this discussion in spite of your jam packed schedule.
Thank you,
Thank you.
Dr. Aparna, for inviting me. Appreciate it.
Yeah, the first question which comes to my mind, and I am curious in asking you that what brought you to Ayurveda, sir? Like, how did you incline towards Ayurveda?
You know, in life's journey, you are often meandering, you are searching for something that is deeply meaningful to the totality of your own life, right? So, whether it is a personal pursuit or it is a professional pursuit, ultimately it's about aligning and ensuring that that which one does is deeply meaningful, what you might call your own swadharma, right? So, figuring out what really is that thing for which you have come to this to the to this world. So in that sense, at some stage something resonates more deeply and in a way that is not a temporary uh, feeling or emotion, but something that you know is much more likely to be abiding and potentially for the rest of one's life. So that discovery some years back led to the fact that Ayurveda affords tremendous scope for learning, self-learning, in areas of great personal interest, at the same time of potentially huge social impact. So both these things could coincide or could converge into and could go in together, and therefore that was the realization that perhaps it was worth exploring deeper, and that intuition often, not often, never leads you wrong.
Yeah.
So that's it.
Thank- yeah, that's wonderful. So, so what is the vision of like Ayurved, sir? Ayurved here. So, why is what is it? How is it creating a difference to the lives? So,
Well, I don't know. I shouldn't say in terms of what difference it has made. That is for others who have partaken of our services to comment. But I think I can very honestly, frankly, share the vision with which we were set up. The vision was to pioneer and lead the transformation of Ayurveda into a mainstream system of medicine. So 18 years back, we felt that this was a worthy vision, and it is a very difficult vision, but it is a vision that is realizable in the medium to long term. Medium is 15, 20 years, and long term is even longer. So this was a certain understanding, and that vision was backed by an appropriate mission statement, which was in terms of establishing applied Ayurveda as a treatment of choice for select medical conditions and by increasing its reach globally. So it was very clear that this was the path we had to take to achieve that vision. So it was not a shortcut path.
yeah, thank you. And sir, for the audience, Ayurved is one of the few NABH accredited hospitals and JCI accredited hospitals uh, in the country. So NABH is an accreditation board, which is called National Accreditation Board for Hospital and Healthcare Providers, and JCI is Joint Council of India, which ensures that the patient safety is the first motto and quality healthcare. So, what? How did you come to this conclusion to that Ayurveda should have NABH? And what do you think, sir? What difference is it making while having NABH in Ayurveda? What is the difference in patient care and safety?
Yeah, so I think this question is an interesting question. It has not been asked in the manner in which you did ask, Dr. Aparna. So if you really look at it, the genesis of even AyurVaid, right, and the JCI stands for the Joint Commission International, which is the international arm of the JCAHO, Joint Commission for Accreditation of Health Organizations of the US. Hmm? So the international arm of that is this. So what is the genesis of this entire quality movement in healthcare is very important to, first of all, keep in mind. So in 1999, in a very seminal study, the Institute of Medicine in the US came out with a study which said that 95,000 people in the US died due to medical negligence in the preceding year. So this study shocked the entire world. That number has gone up multifold in recent years because the methodology has become more accurate. So if you really look at it, the number of people you can imagine dying in India because of medical negligence will be 10 times or maybe 50 times that number, potentially. Because there is no documentation really there. Maybe people are catching it through some level of documentation, potentially. But anyway, keeping the comparisons apart, if that was the case, so in the year 2000, a movement began in healthcare of telling how do I bring the same concepts of quality which is present in other sectors like manufacturing or services, can I bring it to healthcare? So in the year 2000 is when probably around that time the JCAHO was set up. And then you have the AHRQ, the American Healthcare Reliability and Quality body under the government of the US to tell how do I bring reliability and quality. What does reliability mean? I can depend on what is being done and the reliability of each of the inputs into a process. So the reliability and quality in the context of healthcare, we will understand. So this was all created in the US. So around 2005, when AyurVaid was we conceived setting it up, what came to mind was, before we come to the quality standards, what you have to understand is that Ayurveda at that time, I'm talking about 18 years back, had fallen into two grave pit, into great, I was going to say, had two great pitfalls, or it had fallen into two big pits. One was to confuse it with a Aushadha Sampradaya, right? So everybody at that time itself said, give a medicine for this or that, and that is Ayurveda on one hand. The other side, which was very predominant, is that as a service, you had without naming the companies, there were well-known companies which are launched a, a chain of Ayurveda massage parlors. They called it as therapy centers, but they were actually more of casual massage centers. And then the tourism team department, Incredible India campaign, all of that positioned Ayurveda as a massage service. So in the process, what happened is, in people's mind, you had these two impressions. Number one, you had the products business, right? I take a kashayam or arishtam or some other medicine. On the other hand, I had the massage, right? In between, the science of Ayurveda or the Shastra, or the what was being missed was the very structured scientific application of the principles of the Ayurveda science for, as you told in the beginning, for swasthasya swasthya rakshanam and vikaram, atarasya vikaram
Vikara
prashanam. Yeah.
Prashanam.
Yeah. So this particular, or vyadhi mokshanam, giving him
Vyadhi
freedom.
Parimokshanam. That is true.
So giving moksha from vyadhi, right? So this whole thing was being missed between these two stools. Therefore, one fundamental thing to understand about Ayurveda, that it is a chikitsa sampradaya, not a aushadha sampradaya, not a kriya sampradaya alone. It is ahara, vihara, maybe vichara, because that's your core area of focus as a professional. Ahara, vihara, vichara, aushadha, and then kriya krama, right? One or more of these depending on the rogi roga avastha, right? So if I had reduced this very powerful, customizable application of Ayurveda into a mere medicine thing, you talked about paracetamol, and I don't want to blame. Why should we take paracetamol as an example? All Ayurveda people, most of them today, are going into the same route. So we should not tell one size fits all and say that blame somebody else. In the sector itself today, you have a one size fits all approach to many, many conditions, correct? So this is the challenge which we face today. So the moment I look at it as a chikitsa sampradaya, what does it mean? It means very important things. It means there is a vaidya and there is an atura. There is a doctor and a patient, correct? Without a doctor being in front of a patient, you cannot have, whether it is virtually or whether it is physically, you cannot have over-the-counter approaches to Ayurveda, which is the bane of Ayurveda today, right? It is
Right, right.
allowed to go, anybody can go to a shop and say, give me this and that, and without a prescription, you can buy. So if you really look at it, the fact that you have a situation that a chikitsa sampradaya, where a doctor and patient giving ahara, vihara, vichara, aushadha, kriya, depending on rogi, roga, avastha, right? That approach was completely lost. And to bring back Ayurveda, you have to think, the moment I think of chikitsa, it has moved from being a product business to a services business, right? The moment you look at services or products, in any case, what was very important, a lot of times people have reduced Ayurveda to Nadi Chikitsa and this type of shortcuts again reducing the sheer, not just the glory, but the sheer massive, the mega imaginative capacity of Ayurveda to something like a Nadi, right? The tragic nature of this sector is that we ourselves go and try to kill our own science, right? Reductionist approaches. We blame allopathy. Why blame allopathy? We ourselves dilute our own science. So anyway, so if it is a chikitsa sampradaya, the question that comes is it a science? Or is it again completely subjective and a personality oriented practice of the science, right? So there are some great apurva vaidyas, as we say, or let's say there are some great uttama vaidya, as they know. Then in the 7-level vaidya gradation, there are many vaidyas that are doing superior Ayurveda chikitsa. However, what we really miss here is that if it is a chikitsa sampradaya, really, and there is a shastra backing it, There is anatomy, there is physiology, there's pharmacology, there is a process. So how do I say it is a Shastra? Not just because I like it and say Jyotisha Shastra, or I say, Ayurveda Shastra, right? Does it become a Shastra? It becomes a Shastra when I study a phenomenon. I study a phenomenon, characterize that phenomenon, and say this phenomenon now is like this. These are the stages: anatomy, physiology, the state of the etiologies, the contributory factors which are contributing. What are the disease evolution status in this person, and then I predict that if I don't do, where will this disease go? If I don't intervene, where will this person's health, that rogi roga avastha, that where will it go? Or if I do something, how will I change that trajectory of the person's ailment? I hope I'm clear, right? So
Absolutely.
if I'm able to predict that by my intervention, the path of this roga in this rogi will change from going, so I'm going from Bangalore, let's say, to Mysore, right? If normally, and that is the thing, and then let's say that that is a disease path for me. So I am telling by my intervention, I'll make him go not from here to Mysore, but from here to Hassan or to Belgaum, right? So I make the trajectory change by my intervention. If I'm able to predict that and make it happen, then Ayurveda is a Shastra, correct? So that conviction that Ayurveda is able to do that, it is able to predict in advance what will be the impact of my chikitsa and make it happen. That is why it's a Shastra. So the moment it is a Shastra like that, of this kind, the question comes, is there a quality standard which can be applied to it? What is a quality standard? A quality standard defines, and particularly in healthcare, what does it do? It says, how do you, the entire provision of care, right? So even the JCI and the NABH, etc., typically, I would say most healthcare standards have 10 chapters. The first five talks about how do you provide care to a patient or the medical side, and the other five are about the management of the healthcare organization, so that there is a quality, and that's what leads us to this precision business, the quality of outcomes, all of that, right? So the quality systems driven healthcare means there is a sequence. So there is quality systems and quality processes, all of which ensures repeatability in an organization. So what became important, therefore, that if Ayurveda had to mainstream, it can mainstream only if it can go beyond being subjective practice. That means there is a great doctor ABCD coming from this family tradition. Because of that, he's got some siddhi with which he is able to do Ayurveda, as opposed to that telling, no, Ayurveda is a very process driven approach which defines how a Vaidya should approach the assessment of a patient, then come to the conclusion of disease. From there, what is a medical plan? That entire set of process, which I can expand upon later, is very well defined in Ayurveda. If it is well defined, you can bring in a quality system. So what was beautiful was NABH came in October 2005. JCI came somewhere in 2000, 2001. If you take the American standard, it is independent of any medical system. That means you can take the American standard. It does not, whatever the values for patient care come, is not specific to Ayurveda or allopathy. So what is the beauty of the evolved systems of quality accreditation is that it is independent of whether it is Ayurveda, homeopathy, allopathy, anypathy, right? So that gives a great opening for Ayurveda to go to a global standard. And subsequently, NABH came in a way that it took almost everything which was JCI and came with a standard in India. So why I bring this up, it's very important for those who are interested in Ayurveda seriously to realize, first of all, a lot of people say, oh, Ayurveda, you cannot do process. When we first became the first NABH accredited hospital in 2010, at that time, the Secretary Ayush said it is a historic moment for Ayurveda sector for one reason, because then
Exactly.
people will believe that it is possible in Ayurveda. Till then, everybody would tell, oh, all this is fine, but Ayurveda you cannot do. So that is because of a misconception, right? It is about how do you look at process-driven Ayurveda. This was one part. And the other part was very clearly that the quality systems for patient care, what do they try to do? They try to increase the probability of positive outcomes and not do harm to the patient. Both these things are important. You give increase the probability and then reduce the chances of causing harm, right? All of this is very important for Ayurveda. And so I thought NABH was a fantastic opportunity for Ayurveda sector to leapfrog and come and say, and what is the beauty is IT sector, has allowed India to leapfrog from early 90s today to be a world leader in this area, and which is also propelling India's growth. Similarly, in healthcare, Ayurveda sector is potentially in terms of impact where the IT sector was in the mid 90s, and Ayurveda can tomorrow actually have the same impact on global healthcare in another 10, 15 years, like Indian IT has had on the.
Yeah, it actually makes me feel proud and gives me immense joy that there are NABH accredited hospitals in
Oh,
of Ayurveda in India.
there's so
So
many, close to
yeah, there are so
150.
many. Yes, there are so many. Sir, my next question would be: everybody has an opinion on Ayurveda. People say that Ayurveda is only ginger, turmeric, tulsi, herbs, and kashayas, and whatever. But when we talk of evidence based Ayurveda and creating awareness, how to, have an impact and build a evidence based Ayurveda, and how is AyurVaid working towards it? Because I have seen a couple of videos on talk evidence and precision Ayurveda on AyurVaid's
Yeah.
YouTube channel. So, how do you think we can do that? Because it is important, I feel, to create awareness about Ayurveda. As you said, there are many misconceptions and misinformations in terms of Ayurveda. So how to proceed further?
Yeah. So the I think you may not be aware that we won the National Quality Award in 2012, competing with modern hospitals. We are the only Ayurveda organization to date to win a National Quality Award, and that too competing with in an open competition. When you look at evidence-based Ayurveda, it becomes important to look at it. First of all, there are two ways to look at it because evidence-based Ayurveda is a very umbrella term. So, first of all, we need to understand there is an evidence based diagnosis. Is the first step. How do I come to a diagnosis which is evidence based? And then, for a given diagnosis, how do I come to an evidence based plan of care? Right? So, what does that mean? How do I decide what to intervene with? Right? I told you about Ahara, Vihara, Vichara, Aushadha, Kriya. So how do I intervene? Having done the intervention, how do I come to a evidence-based provision of care? So I've decided I want to do this. Now I need to ensure that what I do is done systematically. And then finally, once I provide the outcomes, provide the care, I need to ensure that the outcomes that are coming and safety are monitored systematically. When I look at that, this whole 3 or 4 step thing becomes highly complex in Ayurveda, as you know, for certain reasons. Number one, it is a multimodal intervention. What does multimodal mean? I'm intervening not just with a single drug, right? I'm intervening with a black box of input. So ahara, vihara, aushadha, kriya is also going there together. And technically, if I have to do the and why am I doing it like that? Because Ayurveda's approach, you talked about Roga Samprapti, right? If I have to do Roga Samprapti Vikhatan, Ayurveda will posit a particular approach for that. And one very important thing which we need to understand when we talk about comparing allopathy and Ayurveda, and even talking about Ayurveda, we assume that the objective of that Ayurveda intervention and the allopathy intervention is the same. It is not. I hope I'm clear.
Yes,
No,
yes,
but
it is
it's
not. Yeah.
it, no, it is taken for granted that when you're talking about my thing worked here, that thing worked there, it is not right to compare because there it's got a particular purpose, here it's got a particular purpose. So even Ayurveda also, there is a need to talk in terms of am I doing Roga Shamana, that is just temporary symptom alleviation, or am I trying to do Roga Shanti or Roga Nivritti, right? So Roga Mokshana, right? So that Parimokshanam, as you say, is that my objective? So if I'm trying to achieve parimokshanam, I have a certain set of tools. If I'm trying to achieve just shamana, I have a particularly totally different approach. So these cannot be compared. Unfortunately, again, modern medicine to a great extent is into rogam shamana, right? 99% of what they do is shamana. So I can't compare my parimokshanam approach to a shamana treatment. Okay. So then when I've got these multimodal things, so the treatment objective being different, how do I say that I've achieved parimokshanam? I have to see that the symptoms alleviate now, but also tomorrow, after 3 months, 2 months, right? If it is a sukha sadhya, krichira sadhya, yapya, depending on that, my sadhya, sadhyata, whatever I'm predicting for a given disease complex which is there, whatever I've told is the sadhya, sadhyata, I should fulfill. There's no point in telling that I did some treatment and temporarily there is a shamana of the symptoms, and then but after day after tomorrow the symptoms reappear, or after 1 week. So we have to be very clear. That is why one of the key things in this evidence-based Ayurveda, before we get to anything, is how do we even measure outcomes? It is not use of technology. It is even that concept of telling I first of all need to define my goalpost. Only then I can go towards the goal. Clear? So we go back to the point. On this is one side about the way we need to look at evidence-based Ayurveda, to be broken up into these 4 stages and not to get mixed up on whether I'm doing shamanam or roga nivritti. And then the other part to realize is that from an Ayurveda perspective, what would be the best way to approach the subject of an evidence-based approach for anything that I do, right? So as we know, there is the pramana, very well-known pramana, that which I put it in this order: pratyaksham, anumanam, aptopadesham, yukti. Right? So when I do yukti, vyapa, ashraya, chikitsa, I cannot jump to a conclusion, which is what is happening very often. So some people would say begin with aptopadesha, then pratyaksha, anumana, and then yukti. But actually that is a misunderstanding. I need to have a base of aptopadesha. I need to have aptopadesha so that I can do the pramanas, I can do the pratyaksha and anumana properly, right? But from there, the formal process of going back to the aptopadesha. So there is already a foundation. Then I do pratyaksha, which is trivida pariksha, panchendriya pariksha. I'm able to do a proper rogi roga pariksha, right? I do the pariksha based on the full pariksha, not just ashtasana dashavida. I have to go beyond it. Okay.
Yeah.
So going beyond those parikshas, how do I come to a proper understanding, enumeration of the Vaigunya Lakshanas in Dosha Dhatu Mala, which is basically Srota Pariksha. So I have to do a Srota Pariksha. From the Srota Pariksha, I have to go to the Nidana Panchaka, right? So unless I go through this process, it is not evidence-based diagnosis. I not even read the other things. So I have to go to the Nidana Panchaka, then I have to have the going from the Pancha Nidanas to the Pura Rupa, Rupa, Upashaya, Anupashaya, then going to the Roga Samprapti Ghatakas, right? If I don't do all this, I'm doing a shortcut of Ayurveda. But this can be done, has to be done. Whether it is a Manasika Roga or it is a Sharirika Roga or both are all intertwined. The key thing to understand, I need to go through this process. Then I have to decide, is there a need for a differential diagnosis, and then only I can come to a Roga Nirnaya, right? Roga Nirnaya not in terms of allopathy alone, right? I have an allopathy, but I'm seeing from an allopathy perspective whatever their diagnosis is. From an Ayurveda perspective, I need to understand at the level of the dosha, dusha, samurchana in different dhatus, srotas. I have to figure out what are the sampraptis which are leading to this particular lakshanas. So unless I have a means to connect the nidanas to the lakshanas or the vikriti lakshanas or the pradhana vedana, I'm connecting all of that. I've not understood the person in an Ayurveda perspective. So if I'm talking about an evidence-based approach to diagnosis, I have to come to this through this very systematic process of diagnosis. Having reached that particular point, now I get to a stage where I have to decide what is my chikitsa objective, right? I only read the point about I can see, and roga is not one single roga. The roga is the absence of arogya. And what is the absence of arogya? The totality of all the vedanas, right? The mental, physical, everything, all the imbalances. Then I have to first of all decide what is it that is my treatment objective. And this is not just my as a doctor, my decision. I have to work with the patient. Doctor and patient work with each other to decide what is it right now we need to do, what is it that we do later, right? So this is to be agreed upon between the rogi and doctor. Once that is done, then I come to what is called the plan of care. What is the plan of care? How do I now approach the chikitsa of this person with a certain set of vyadhis or with a certain set of vikritis, right? So for that, I come. So then the first part of evidence-based diagnosis has been reached. Then the next step comes to, of course, in Ayurveda, we do something very important. Our doctors decide, can we manage this patient at our center or not? Right? It is not that, oh, a patient has come here, now let me do. So there are two parts here. Am I, as a physician, capable of treating this patient? Do I understand this roga enough? Right? Does it come within my grasp to treat? It's not that Ayurveda can do or not do. Can I do? Number one. And can my center do? At my center, I have a certain scope of care. I may be a clinic. I may be just a telemedicine consultation point. I could be running a clinic with pharmacy. I could be running a clinic with therapy room. Does it fall into my scope? Right? Or do I need to refer to another Ayurveda Vaidya? Or do I need to refer to another allopathy Vaidya? Do I need to do some type of risk mitigation by getting some more investigations? All of this I need to do very, very uh, systematically, right? So there is a question which has come, but I think we'll answer that separately. Dr. Anjana has asked a question. I think we'll come to Sattva Vajaya Chikitsa. We'll come to that. So if you look at this whole approach which is coming, I need to have a Chikitsa Siddhanta, which is how do I approach the Samprapti Vighatan, right? And then I have to keeping in mind the overall principles for this patient. I will then come to from the Siddhanta. I have to come to the Chikitsa Paddhati. How do I come to the Paddhati? Right? These are typically what is happening. A patient has come, immediately I go to Paddhati and give him a medicine, right? Or I start advising. But before that, I have to go through the process, and then I have to understand the whole point that the Chikitsa Paddhati is based on Desha, Kala, and the Rogi Bala. So I have a treatment principle. I have to link this. This is how Ayurveda would have already posited. But what is happening today is shortcuts in the Chikitsa approach. Now, once I've done evidence-based plan of care, I've got then to do two more things. I have to ensure that if my treatment plan is for 20 days, the compliance to that treatment plan, which is Ahara, Vihara, Aushadha, Kriya, right, and Vichara, all of this is complied by the patient. Very, very difficult. Unlike allopathy, where I'm giving one pill, I don't care about diet lifestyle other than some very complex things. I just tell, take this pill or go through a surgery. I'll do a surgery in 3 hours and you're out. So because of all of this, you have a highly complex thing to ensure that over 21 days or 18 days or 14 days or 10 days, whatever is your intervention, whatever is the Chikitsa Paddhati, which has been told by the Vaidya, is followed through by the Paricharaks, by the doctors systematically. That's where, again, you need quality system. The
Right.
beauty is that Ayurveda, unlike what most people say, is very, very amenable, is very ready to take all these quality processes, right? But we say, nahi, nahi, ye Ayurveda mein nahi hoga. Bilkul nahi. It will definitely, all of this is possible. So the moment you bring that in, and along the way, what is characteristic of any process-driven approach is that you have measurements at every stage of care, right? So when you provide the care, you need to have samyak lakshana to be measured. You need to track also the pradhana vedana. All of this you keep tracking so that if I cannot do good, I should not do harm. So this whole approach should be happening simultaneously, right? And then, so safety and efficacy. And if I am able to track outcomes, how do I track outcomes, right? Do I just say, patient is better? I have a 3-point scale, low, medium, high. Everything else say it was low before, it is high now. That is not evidence. So how comprehensive can I make the evidence? Are there biomarkers? Are there scales of outcomes? Are there patient-reported outcome scales? Like that, multiple dimensions to outcomes that can be measured. So Ayurveda makes it very complex because It is meant to treat the rogi, the roga and the rogi, not just the roga, right? So you need roga-based parameters, you need rogi-based parameters. Now, in a world that I think, Dr. Aparna, that question, would you like this to be talked now or should we talk later? There's a question that
I
would you like to, oh, yeah, or
later,
should,
sir.
what,
First, let's
later?
complete this. Yeah.
Sure. So I think when you look at this four-stage thing, then you realize that Ayurveda is eminently capable of following this discipline. But Pratyaksham, Anumanam, Aptopadesham, Yukti is only coming to the point of reaching the diagnosis. After that, you have to go completely. Then you need a well-trained team. So I am doing Abhyanga. I am doing a Niruha Vasti. Am I capable of doing a correct Niruha Vasti? Is the Dravya used for Niruha Vasti, is it properly made? Are all the Dravya elements there? Suddenly you'll see the complexity. It is not that I just go and do something in a, I prepare in my kitchen and do a Niru Vasti. The great advantage of Ayurveda is that even with all these inexactitudes, right, things which are not exactly done, still the patients get very good outcomes, right? So that is a level of scope the human body is waiting. The moment Ayurveda approaches, the body is responding. So, but we can do such a better job of bringing in that precision, right, into every step, right? So it's very much possible to do this. And what you'll be quite surprised is that the documentation that is possible in Ayurveda, every case, each person is unique, is so immensely possible to bring in, right? It's not that it is difficult to do in Ayurveda. You can do it very much. And that is what is going to be the main contribution of Ayurveda to the world, that you can come with uniquely personalized medicine, which is the principles can be applied in any part of the world, whether I'm in India or the US or in Afghanistan. I can apply the principles in any part of the world and
Right.
still it will work.
Sir, this is a follow-up question with this. When you have beautifully explained how to bring the evidence-based Ayurveda, but how to spread it, like how to create awareness from this evidence-based Ayurveda, because you are bringing, because people are doing great work in Ayurveda, but it is not reaching people. People are not getting to know. So, how do you think, in your opinion, we can improve this?
I think to a great measure, think people are getting to know more and more. So it's a process. I think we have to keep doing it. But I think what is also being getting known more is that there is a Chavanprash or there is a Giloy or there is some aloe vera juice, or this is what is being known a lot more than the fact that it's a science, it can be done. So I think we have to begin. It's a long-term project. We'll have to keep talking in the colleges, and the young doctors who are coming into the system. Many of them are of the brightest quality, highest caliber. If they are inspired to really take this path and not take shortcut paths, then I think we'll see gradually emergence of a very, very powerful new generation. There's no shortcuts, Dr. Aparna.
Yeah. What does actually the talk evidence do? And matlab, what does it do on,
Yeah.
what is its
So I
role?
think you're talking about the series that we run
Yes,
on
yes,
Ayurveda.
talk evidence series.
Yeah. See, I think one very important thing to understand, I mean, I've used it in one comment on LinkedIn, the main thing is Swadhyay, right? The self learning or practice and abhyasa and then learning and then reinforcing. What you'll realize is that the process of writing um, in a case, in a Athura Patrika, okay, and then writing the medical records. As I keep writing and writing, the brain is getting trained to think systematically. We've been doing this for 18 years from the first patient, right? Very detailed documentation. So what happens is, whether it is our Vaidyas or it is the Paricharaks, each one has got a different set of documents to fill up. So everybody is getting used to writing. The moment you write, your brain gets disciplined, right? You're training your mind to think clearer, better, put down your thoughts. When I have to speak, I can speak anyway. But when I have to write, I have to think twice and thrice before I write, because I know that I'm recording what I'm thinking. So I think gradually I will move towards a higher level of competence, which is where the mind is trained to think without thinking. It does automatically the right thing. So the key thing which I would say, talk evidence similarly, when I have to present my thoughts to a Vaidya Samuha, right? What happens? I cannot do it just by telling the kind of cases which may be typically told. I have to give this evidence-based approach and show that this is how I came to it. I know I am open to criticism. I'm open to questioning, right? When I say criticism, does not mean negative. It
Yeah,
means
yeah.
basically
It means
criticism in a
constructive as well. Yeah.
yeah. So vimarsha, if you want to call that constructive discussion on the topic, that makes me prepare, right? So that I may be asked both on the siddhanta, yeah, on the paddhati, and then what is the evidence which led me to all of these. So I become disciplined, and then you're also learning to work together as a team because I am so the whole process we believe of this swadhyaya is encouraged by this whole process of doing work and presenting, and particularly as we grow into multiple centers, it's important that doctors collaborate across centers to present the very good work, and it's very inspiring because why does good Ayurveda continue? Because the good Vaidyas who do with good Paricharakas do extraordinary work. That work, when you see when a patient who's completely paralyzed getting up and walking, right, or the actual outcomes, that gives the confidence. So that is why you need to present evidence. But it's very important here also to bring one very important to restate a point. Often talking evidence is only talking about the good outcomes. There are also the poor outcomes, right? And
Right,
the
right.
and the vyapats that can happen during care. Now, by not talking about the vyapats and the poor outcomes, what you're doing basically is only showing the good news and hiding the bad news. So, bringing that the concept of healthcare quality is to ensure that you openly acknowledge that there are faults which are happening, so that we together collectively as a system we strengthen. When we say that our medicines don't cause any side effects, we are fooling nobody,
Right,
right?
right.
So we have to be clear. Our medicine, the right medicine for the wrong person, the wrong medicine for the right person, whatever, all these things can cause the dosage, the timing, all of this can go cause issues. So we have to be very, very particular on not tell that we are herbal, we are 3,000 years old, so we are safe. None of that works, right? So in the modern age, you need people who take responsibility for the status as a Vaidya, right? And tell that I am accountable to the patient and the families to give safe care,
Right,
the care
exactly.
that gives outcomes.
Beautiful, sir. Sir, Ayurveda is following the integrated oncology approach or the integrated approach. You are tied with the hospitals. So, what is the level of integration you think it must be followed? Like, where should be a boundary, or there should be some significant things that you think is essential when we follow integrated approach?
So integrated, integrative, or these are words which are used in immiscibly or they missibly. That means they use
Controversial, yeah.
interchangeably. These words are used interchangeably. So let's take that integrative is where multiple players, multiple systems of care, and it is today got a connotation where integrative says going beyond physical health to the mental and the emotional, spiritual well being of a person, right? So, a lot of people are telling rather than restrict it only to physical, I need to go beyond that. Integrated has become more of giving multiple things together, right? So, idea is that in integrative, you look at the totality of health uh, objectives. Now, going to the point on how does integration work, right? You have to understand one thing that most patients who come today to any doctor have multiple diseases. Okay. So to imagine that somebody comes and says, I am diabetic, please treat me. So I give you this medicine and then forget my job. That's not the case because he'll have diabetes along with hemorrhoids, with Parkinson's, with gas problem, with backache, everything together in one person. Now, a proper integrative approach will mean to say, this person has got 4 or 5 things. Where will I use Ayurveda? Where will I allow allopathy to continue? Where will I bring Ayurveda with allopathy and slowly wean off as Ayurveda medicine takes impact? I will wean off. Where will I ensure that my Ayurveda medicine does not have a drug to drug reaction and have a problem? So, patient is already on an antihypertensive. I am also giving an Ayurveda hypertensive and he's got hypotension, right? That is not integrative care. So there is both the safety and the outcomes for people with multiple issues. There's one way to look. So what would a good Ayurveda responsible doctor do? He would say, he would not say stop all the allopathy, start with Ayurveda. He would say this allopathy thing, it seems it keeps this condition under control. Please continue with it. This part I bring in Ayurveda where you're not taking anything. Third thing, here you start with Ayurveda along with allopathy. Slowly we'll see if you can reduce your allopathy. This is a responsible one thing. Number two, when I look at not just allopathy but modern technology, right? When I need to do differential diagnosis, right? Rather than Ayurveda doctors going and learning how to do sonography and trying to do ultrasound or MRI learning, there are either radiation technologists or there are radiologists, so on, specialists who are good at that. Why would I go and learn that? So what would I do in a proper integration? I would work with those parties and ensure that we are able to work together in the best interest of the patient. I want to conclude by this telling that risk mitigation is a very key thing for Ayurveda doctors to ensure that I use the benefit of modern medicine. But to complete integrative, we have to understand there is a concept of adjuvant care, which means that you're able to take patients who are undergoing chemotherapy and see what can I do from Ayurveda to make the patient to be able to tolerate the chemotherapy better, right? Or I look at, so that is adjuvant care, okay? Or I can precede the cancer therapy from modern medicine with Ayurveda so that the main care the patient is able to tolerate better and have minimum side effects, right? On the other hand, you have what is called rehabilitation, which is post core thing. How do I ensure that the patient goes back to positive health quickly, right? So this whole picture of pre and post emergency care or acute emergency care is a role that Ayurveda can play very well. That is also integrative medicine, right? And this is a very responsible way. And when doctors work together, there are many serious road traffic accident cases, etc. You would have seen some of the videos that are there on our channel, YouTube channel, where severely affected, quadriparesis patients. We have in some of our centers like Aster CMI, where we have Dr. Rakesh Nair, Dr. Shweta Suvarna, Dr. Kaveri Kuttappa, and the team, right? How they are working with the neurosurgery team, the physiatry team, etc., to rehabilitate patients who are very acutely impacted. Or go to Sri Shankara Cancer Care, where Dr. Jankana, Dr. Swati Bhatt, Dr. Vimarsha are working with the oncologists there in proper adjuvant and rehabilitative care. So these type of things is the future of Ayurveda, but it cannot happen with the loose, claims by Ayurveda. It has to happen systematically, very thorough homework being done, because we have to earn the respect of our counterparts. There are many people who are close to Ayurveda, but there are many who are open and are willing to listen, provided we are able to speak with authority. So integrative
So,
medicine is the system of the future, is what I would like to call.
do you also think Ayurveda doctors should also know about other systems of medicine in order to tackle the side effects, or like that? Is that also an integrated approach? Like, because that also
The way
comes
it
as a
is being,
question. Yeah.
see, I need to know how to read, a CAT scan report or the blood reports. I need to look at investigations and understand. I also need to be able to look at the latest papers published in modern medicine, which are telling or over a period of time. So, how do I correlate? That's a good question. How do I correlate modern medicine findings? And they have large clinical, studies happening, which are telling in a very focused area, telling correlations they are finding, right? So between different diseases, and today they are also realizing that the approach they have taken for the last 30 years, 40 years is not working. So we need to understand that. But to go to the question that an Ayurveda doctor should learn allopathy, I am strongly against it. I feel, first of all, Ayurveda doctors should know their science thoroughly. That's the key basic thing. Along with that, I should know enough to engage with the modern medicine partners. And then I will learn. As I get into practice, I learn working with them, and you have to do. So without laying the foundation properly, I'll give you an example. When you learn a language, right, they normally say the child should be spoken to only in the mother tongue or the primary language. Once the mother tongue is very solid, that child will learn any language very fast, right?
Mm,
So similarly, we need to learn our mother system, which is Ayurveda, properly, and then go to other systems.
yeah. Sir, for me personally, it is disappointing to see Ayurveda being treated as just as alternative system of medicine or just the traditional system of medicine. When do you think will Ayurveda emerge as a mainstream medicine? I
I
think
think
in is it possible even?
very much. It's definitely possible. For example, there is you'll be happy to note that there is a Arogya scheme of the Karnataka government, right, which covers about uh, 500,000 government employees and their families. Okay, 6 lakh people are covered under that.
Okay.
Recently, they have moved to bring Ayurveda coverage after so many years under that. Similarly, tomorrow, if an Ayushman Bharat scheme, right, Pradhan Mantri Ayushman Bharat Yojana, if that covers Ayurveda, suddenly it will open up and all the doctors will get gainful employment. Only point is, are they ready? So the question should not be when that will happen. If the Ayurveda doctors are ready, the market will open up. Mainstreaming will happen. The challenge
But we
today,
have to get the opportunities as well. As far as we treat Ayurveda as alternative system of medicine, it will always remain as alternate system.
but
Yeah.
who is treating as alternative, right? Are you? Am I treating as alternative? What does that mean? The way I approach is like, I am a poor fellow. I am like, like some poor country. I need help. The doctors who have all succeeded are doctors who are extremely confident in this own science and the practice. So rather than look for freebies, etc., if all doctors start practicing the authoritative proper science, that alternative tags all will fall, right? So the everywhere there's enemy is not outside, enemy is only within.
And are there any plans of Ayurvedic centers going global anytime soon?
I hope so, but it's a complex subject because of the regulatory environment for Ayurveda to be practiced in different countries. But there are some opportunities. There will be some countries where it will be possible, and part of the mainstreaming will also entail, for example, in Mauritius, they're permitting it. There could be some SAARC countries where it can be brought in. There are other the Caribbean countries where Ayurveda may be practiced in, or South American countries. So there is a possibility of that happening sooner than later. And I'm hopeful in the next 5 years you'll have a lot of Ayurveda hospitals. Not lot, but significant number. You'll be, I don't know if you're aware, but in Germany, for example, in a place called Hattingen, there is a good integrative medicine neurology center, where
Okay.
they do proper, pure Ayurveda along with neurology. So places are opening up. Definitely, you can see a lot more happening.
Like, what do you think, in general, is the future of Ayurveda Chikitsa in India and global?
You know, I why I'm pausing to tell is because that's a question that is redundant to ask. And the reason being, it is unlimited potential, but there are limited challenges. Okay. So what I'm telling that it's got such huge potential as a healthcare system, beginning with what you told, that swasthya rakshanam for that part, then to look at the disease reversal, both these things coming together for the global market, right? Huge potential. And of course, the while we have talked about it, we have left the Sattva Vajaya Chikitsa to the end, but looking at the body mind complex and telling many of the diseases where the mind is fully involved in the disease pathogenesis, right? So, which is increasingly prevalent today. Ayurveda will be able to give this whole person approach, which combines all these dimensions of health and give that approach. But can the Ayurveda sector rise to the opportunity is the only question. How soon, right? So we continue on our path, but it cannot be done by one or two or three or five company organizations. It has to be done by every Vaidya who says, I want to go on that path of very rigorous, Shastras based, very pure, uncompromising Ayurveda Chikitsa.
Like, Do you see any changes in the next 10 to 20 years? How our people would perceive Ayurveda
Next
from now? Yeah.
next 2 to 3, 5 years, you'll see significant changes happening. Be sure.
Okay.
20 years is a long, long time, Doctor Aparna. We have come a long way, but next 2 to 5 years, you should be seeing significant changes.
Yeah. I think you said there are some questions. Let us see what are the questions.
Yeah.
Questions. Would you like to know how to position Sattva-Vajaya modality, whether to be considered separately or shall it be integrated in the Samprapti approach? So Manas should also, she's asking, Manas should also be taken into the consideration or not while treating. So, sir.
Yeah, so I think it's a very important question, and it should not be considered separately. So when I look at the fact that when I talked about the parikshas, right, I mentioned different parikshas, but the pariksha of the manas is equally important. And manas is, of course, a technical term, but the mental status examination, if you wish to call it, in a much more specific way, so that the the dhi, dhriti, smriti, all these aspects are looked at in a systematic way. And of course, the manasika doshas or the trigunas, characterizing that very well, and then figuring out what is the impact of the triguna avastha on the sharirika doshas, right? So all this has to be looked at. The fact that Nidana Panchaka looks at manasika, right? So ahara, vihara, manasika, Nidana Artakara, and Agantuja. So these five are coming. The mental factors are definitely coming there. And whether in the Samprapti or in the Chikitsa Siddhanta or Paddhati, we must look at tackling it. And today, because of the extraordinary increase in Rajas and Tamas, we must look at how does the physical approach, the counseling approach, and then the medicine approach, right? So how do we look at that, and making people very much aware of the whole process of perception. And that is a huge area for Ayurveda, because going beyond the psychiatry and psychology, just like that, I think Ayurveda can bring in a very different layer, which, so it's not, if I reduce it to psychotherapy, right? That while the word is there, it immediately, while it is psychotherapy, therapy for the mind, but the moment I hear the word psychotherapy, I'm immediately connecting with the psychotherapy of the West. Whereas if I look at Ayurveda, the mind construct is a lot richer, a lot deeper, right? So whether you go to the Yoga Sutras, the way they have Patanjali Yoga Sutras, or you look at even Vedanta, the way it would be looked at in terms of the wrong perception leading to the creation of desires, right? So raga, the roga, the concept of raga leading to roga, and the most the highest vaidya being one who can treat the raga, the rogas, right? So this is the way in which Ayurveda has seen it. So we should not reduce it. In fact, to that question by Dr. Anjana Warrior, I would say we must bring it in. But the challenge is for an Ayurveda doctor to really internalize all of this, to bring the totality of this, the tridoshas, the trigunas, everything together into one integrated paradigm is not easy. But that is the beauty of Ayurveda, lifelong learning. Vaidyas can keep on learning.
I can absolutely vouch on what you said, because Ayurveda, as much as it is physical, it is psychological as well. So Manas has a great role to play, and we have Sattva Vajaya Chikitsa, but it is rich in Ayurveda. But it is a rich heritage, but it, I would say, it has not been explored much. So
So
there is
when I was
another
looking at that,
question.
yeah, but when I looked at this thing, I was just reading up a little bit, but the the way it was told that ahita indriyartha, the asatma indriyartha samyoga as a wrong
Huh.
perception leading to that, or ahita indriyartha, or
Ahitebhyo arthebhyo
yeah,
manonigraha.
yeah.
Yeah.
So that manonigraha, so that whole concept of manonigraha has become a direct path. But the other part about pratidvanda bhava, right? Creating the pratidvanda bhava as a concept, right? Is, I don't know whether it is spoken of, right? In psychotherapy, how is that being brought at, right? Or manochobanam, right? How do I create shock, and or using excitement, or using krodha to correct kama, right? This opposite thing is a very interesting way, but it has been told by Charaka so many years back, right? So this whole concept of the connecting life purpose is very powerful. I would be very keen to listen to the Manashastra experts on how actually you are approaching psychotherapy as an effective therapeutic tool. Whatever I'm seeing today on even on YouTube, etc., there is a lot of hocus pocus happening in the name of Sattva Vijaya Chikitsa, right? So we need to bring in again the same rigor to that, and look forward to hearing from another expert.
Yeah. Today morning, sir, I was reading a shloka from Shushruta, which
Okay.
says, Ekam Shakam Adhiyano Na Vidya Shastra Nishchayam
Yeah.
Tasmat Bahushrutaha Chikitsakaha. What it means is, so only by knowing one branch or one system of medicine, a Vaidya
Yeah.
cannot achieve everything. So he has to, know different system of medicines. So this has been told in Sushruta Samhita and Charaka Samhita. So
So
I
this
think it is, yeah, yeah.
this
So
you're
I
justifying for the integrative approach with modern medicine, or you're telling that
No, sir,
person
for psychotherapy, I am talking about the psychotherapy because my
okay.
emphasis is on Sattva Vajra Chikitsa and psychotherapy. The question was on that. So
Yes,
I was telling that it is not bad, I feel, to implement these as well, to know and to learn
it is
and
not bad.
implement these as well.
It
Yeah.
is an imperative. It is an imperative, but it has to be very clear that the the process of doing it has to be very well defined, and would be very keen to understand from those who are practicing it on a daily basis that what is the approach, what is the systematic approach they are following for this area, right? Whether I come with a depression or anxiety or a manic disorder, how will we approach all of this?
There is one more question, sir, from Ramakrishnananda Saraswati Swamiji. He
Yes.
asks about actual truth is science technology is not having tools, instrument to prove our Ayurveda. Can you show one tool to prove mantra ayustam? So the importance of mantras in Ayurveda.
Yeah. See, so I mean, in terms of a tool, I think we'll have to ensure that uh, the it's very clear that for every person, right, the path to calming down the internal the I mean, I'm reminded of one particular thing that there was a many years back, a person very dear to me passed away. Hmm? And I was at his just before the body was being taken for cremation. I did I prostrated before the body, and then as I did, some emotions came through my head at that time because he was very dear to me and known for many decades. So as I got back into the car and I was driving back home about a kilometer away, along the way, I told my wife that I'm going to fall ill, right? And there's no external, no agantuja, no ahara, vihara, nothing. Just on the moment that there was a mental something which happened, trauma. And for 1 week, I rarely used to fall ill. I was laid down in bed, so weak, just from that thing of the mental trauma which happened. Now, if you look at mantras, right? So going back to Swamiji's comment, the role of the mind and the spirit, so to say, is so complex. To try to reduce it to even to an Ayurveda would be being too simplistic. So I would say man is a complex being. There are many, many, many factors involved in state of health, and the fact that this ability to do what is called homeostasis, right? How do you restore that physical mental balance in a person so that the living organism maintains a state of health, right? Or balance. That is has got multiple factors to it. So the mind is certainly very much there. So there is not a simple answer. How would I measure it? I would try to measure it through the fact that, I mean, I would give an example, right? We used to think that every patient, the moment they understand why they are going through whatever they're going through, right? Immediately the outcomes are better. And in this connection, I will also share one thing. Many years back, at Beth Israel Hospital in Massachusetts in the US, all cancer patients, before they begin treatment, at the time of diagnosis itself, go through what would be the equivalent of the Sattva Vajaya Chikitsa, but at the same time, the Daiva Vyapashraya Chikitsa, right? So there will be a priest, there will be a church, they can go and pray. All of that was brought in, and they found the cancer outcomes was much better in that group as compared to the group which was not getting. So there is nobody who will disagree, right? If anybody disagrees, he's a fool, right? Definitely there's a huge role. How to bring it in, not mix it up all up and make a hodgepodge, right? So you need much more sensitive, mature, evolved Vaidyas and evolved patients.
One last question, sir. Any message for our viewers? This is from a layman perspective. Like, what should they expect and how should they approach Ayurveda? Like, if they ask, yeah.
You're telling us a layman, a
Yeah, a
Vaidya,
layman
or
who
a
doesn't know anything about like Ayurveda and who what to expect from Ayurveda. Any message on that? Yeah.
So I think one key thing that we say about Ayurveda, two parts, I would say. Number one, that Ayurveda is all about empowering the individual. So you begin by creating the right insights into every individual so that ulkarcha or the Atma Drishti, you are able to see within that insight. You understand what is it that you're doing. So when you're talking from a Sattva Vajaya Chikitsa, that's one of the key things you're doing. You're giving the insight. The right insights lead to the right attitudes. The right attitudes lead to the right behavior. The right behavior leads to the right outcomes. Is one key Chikitsa approach, whether you want to call it as a new approach, beyond the three approaches. This is a key thing of Ayurveda, right? Insight, attitude, actions, and outcomes, right outcomes. Number one. Number two, to understand that, to believe that the one medicine is going to go and uproot a disease, right, is a misconception. What you're basically doing is removing the obstacles for the body and the mind to restore the state of health. Because the body and mind, the natural state, innate state, is to go back to health. What Ayurveda tries to do is to say, oh, there is this obstacle, let me remove it. This obstacle. So in the body mind complex, you remove the obstacles and the body will heal itself. That is the beauty, which is why you have spontaneous remissions happening, right? It is not because of medicine. Then you say there's a miracle. The miracle is nature.
Thank you, sir. That was a wonderful and overwhelming discussion. Thank you for being here, sir. Thank you for being a part.
Thank you,
Thank you.
Dr. Aparna. Wish you all the very best in
Thank
your
you, sir.
journey, right? Thank you.
Thank you. Thank you. And thank you for staying tuned for all our viewers. Thank you.
Thank you all.